Hi, dear nurses. My name is Jijo John. I'm here to talk about an urgent updates coming up with the New Zealand Nursing Council and the Nurse Mod. So most of the people calling me, asking me, email me, what are the new changes going to happen? Here are the changes. As you know, you are required to complete 10 OSCE stations, and each station will cover a scenario representing current nursing practices in Aotearoa, New Zealand. The major changes happening some of the stations. The I will be list down one by one stations. The stations are number one, mental health assessment. In mental health assessment, there are possibility that there might be disease condition, there might be patient anxiety concerns, or there might be a possible of therapeutic communication in deep evaluation going to happen. Also in physiological assessment, the disease condition may change, or there might be an equipment needed to be extra focused. So they might be looking after. There are majorly you need to study about five vital signs. Number one is temperature, pulse, respiration, blood pressure, and also pain. So sometimes there might be some equipments will be removed, some checklists will be removed, something can be added, but you need to be prepared to make sure that which is most important and what are the things you need to be do it available on that station according to the equipment's availability. And a specific physiological station, which will be that third station, they were expecting to do some kind of pressure injury, especially Brandon scale or pain scale assessment or neurological assessment, which is a GCS assessment. So you need to be prepared for all these three, and there might be a possibility that they might be going to ask any of these stations. And in professional responsibility, which we all know that they will be looking about your professional responsibility, especially the cultural safety management, and the session will be expecting you to be work as an advocate and work as a the professional communication, how you deal with the patient with the policies and the process of consent and everything. Okay. And emergency management, there is a possibility adult BLS or a child BLS, or there is a possibility that infant BLS also can be included and can be asked. There might be minor changes, especially your critical thinking and the leadership quality will be evaluated of here, and the team build quality also they will be looking into the sessions. In clinical sessions, there is a possibility asking you to do oral care. There might be a possibility to do a wound care, maybe further action and description of the wound, etc., to be followed, like a time you need to be followed. And there might be a possibility that small changes going to happen on this session as well. And also in the medication administration, the session basically they will be checking with the 5 rates and 3 checks, and you need to go look for all the 5 rates and 3 checks and look for the medication safety and the patient safety. Especially there might be a change happen with oral medications, which is a tablet or a liquid. There might be a IM injection, there might be a IV injection, there might be another possibility of subcutaneous injection as well. So the dosage and the preparation of the medication of in some scenarios, in some situation, if there is a high alert medication, what are the policies, what are the check you need to do it with the other RN has to be followed. So in medication, basically they will be looking at the 5 rates and 3 checks, safety of the medication handling, safety of the patient, and when what are the important things when you handle a high alert medications. So that's all about the medication session. And in the communication and teamwork, they will be focusing on your ISBAR sessions. So you will be handing over. There might be a possibility of the pharmaco knowledge will be evaluated, and there might be a possibility of ISBAR technique. They will be more focused and looking your ISBAR knowledge as well. And critical thinking and clinical reasoning also will be evaluated in these sessions. So then other sessions like especially planning of nursing care will be continued as a nursing care plan, will be evaluating on a prioritized nursing care plan, how you will plan the nursing care plan, how you identify problems from a patient, and how do you prioritize and how you apply the interventions and rational based on the conversation or based on the assessment what you are doing it. And the last one is managing the deterioration patient. You must need to be much familiar with the early warning score, the escalation technique, especially the ISBAR tool, and the critical thinking. And you also need to have some kind of clinical reasoning with the rational. Why are you thinking like this? How you can make safety and benefit to the patient by escalating by following the ISBAR technique. So these are the minor changes going to happen very soon on the OSCE scenarios, but we are not sure when they're going to implement. But remember, guys, it's not about studying a script. It's all about studying the standard, how the nursing council and the nurse mode is expected you to behave on the OSCE station, and also how you can make sure that your patient safety is not being compromised anywhere throughout your 10 station or throughout your nursing care plan or throughout your nursing care. So all the very best. Please study, focus on the standard of competence and the rules and regulations or general instructions given by Nurse Mode and New Zealand Nursing Council. Go through this, additional information and video. Learn about the New Zealand culture, especially the Maori culture and Treaty of Waitangi, and come back with a strong, confident knowledge, and your communication skills also being evaluated. And just study well, prepare well, and all the very best, guys. Thank you. If you got any questions or concern, do text me or message me, and we'll see you on the classes when we will be having online sessions. Thank you.